Dr. John Lyon. I've been in practice since 2001 and I specialize in joint replacement surgery. Every time I step on my feet, I think about how special it is to just be able to move. And when you lose that ability or you have a pain that stops you from doing that, you start to really appreciate that. Technology of medicine, and particularly technology of joint replacement, the technique of joint replacement changes over time. But what doesn't change is the need for patients when they go to get care from a doctor. And so what I really try to focus on is just understanding what their needs are, what their goals are. You know, they come in with a problem, they can't walk, they've got pain, and our goal is to try to understand that problem and try to solve the problem for them. You know, I get a little bit lost in a room. When I go in with a patient, I say lost in a room because I enjoy just the personal interaction, solving the problems of the patient, trying to come to a reasonable solution. Mother Nature is not the same in all of this, and so you have to solve the puzzle, and the puzzle is constantly changing as the patient's care evolves. And that's the fun part about it for me, because we have so many tools at our disposal that we can use to help the patient.